Shifting gears, let's talk about the next issue, how we treat each other. Are we civil to one another? Bullying is defined as negative or abusive behavior over time, not just once and not just by physicians towards nurses. We're talking about all of us towards each other, and most specifically nurse to nurse, and how this can impact teaching students. The results of bullying in healthcare lead to medical errors, poor patient satisfaction, adverse events, increased cost, and high attrition rates. When we feel ignored, humiliated, undervalued, excluded, and receive repeated negative criticism, we quit. And this is reported by both nurses and students. The reality is that bullying in nursing and nursing education, sadly, does exist. Students are often targets because they are on the lower end of the healthcare structure. Apparently, we have all come to accept these bullying behaviors. We might even be acculturating students to accept these behaviors as normal. Clinical faculty are not usually regular staff members, hence we are often seen as outsiders. Therefore, we are placed in a position of trying to keep everybody happy in order to provide a positive learning environment for our students. If you are already teaching, you may have noticed this. The truth is we are sometimes restricting students' access to certain patients or opportunities to please the staff or physicians. Additionally, when you are confronted with bullying concerns in the clinical area, please reach out to other faculty for support regarding appropriate methods to deal with the stress that these experiences can cause. As frustrating as these situations can be, please remember our nursing code of ethics to act with respect. Cybel's article discusses her findings regarding bullying in nursing in more depth. I've provided a link, and I recommend the Advanced website for their archived webinars on this subject for more depth and for enrichment. Some of the titles are When Your Boss is a Bully, Bullying versus Conflict, and when you can, and what you can do about nurses hurting nurses. As nurses, we are aware of HIPAA to protect the privacy of identifiable health information. However, students may not be as aware of HIPAA. Therefore, it's our responsibility to ensure that they practice with patient confidentiality in mind. Students in their didactic orientation most likely have discussed patient privacy and confidentiality, and more than likely they've had to sign a confidentiality statement. However, what you might be wondering is, what about using protected health information in education? And the answer is, we can. We may use protected health information for educational purposes as long as it's used within the teaching institution. In the evaluation module, I share with you an actual example where a group of nursing students took a picture of a patient's placenta with one student in the photo and then posted it to her Facebook page. Unfortunately, the clinical instructor was aware of the photo and did not stop the students from taking or posting the picture. After it was reported to the nursing department, all of the students were dismissed from the program without appropriate due process, resulting in the decision being overturned in the courts, partially because the instructor was aware and had not prevented the photo from either being taken or reminding the students about patient confidentiality. This brings up the issue of students using cell phones during their clinical rotation. Some instructors, facilities, and programs do not allow students to use their phones in the clinical area. However, today many students and other healthcare providers have most of their resources on their phones. So it becomes extremely important for students to be aware of the potential issues and to act responsibly if they are allowed to use their cell phones during their clinical rotations. Of course, as instructors, we need to also be aware of the potential concerns. And it's pretty well known that people have lost their positions because of Facebook postings. In the next video, the National Council of State Boards of Nursing reviews the guidelines for social media.